everyone, I'm Lutricia Bennett. I'm the nurse practitioner and owner here at IW Medical Spa in Cherryville, North Carolina. We would like to welcome you to the Core CO2 event here at our medical spa. This is our virtual event. We will be discussing and doing a demo patient for you to see. We would love for you to stay to the end where we're going to be answering some great questions from you guys. You'll be able to submit them anonymously. And then we are going to be, and if you do stay till the end, you'll be entered to win an actual Core CO2 for free. You will also be entered for some prizes such as Xeomin and Dysport, as well as some others sprinkled in there. So we really hope you enjoy. So, Core CO2. Now, this is a fractionated CO2 system. So, what that means is that instead of it being a continuous laser on your skin, it's basically fractionated. You have an area of normal skin combined with an area where we have basically done the laser. So, when you have that, then your downtime is going to be less. You're going to have less swelling and less redness. So the reason that we purchased this laser and brought it into our practice was we had a fractional laser for probably about 5 years, and we loved it. I still love fractional laser. However, my patients that had deeper wrinkles and lines, especially these lines around the mouth, I could never get rid of. Even with filler, I couldn't get rid of those lines around the mouth. So I wanted to bring CO2 in so that we could treat it. Many of our patients have seen amazing results there. They've had fractional laser, they've had filler, and this has far surpassed those. So we were able to treat these lines more efficiently, treat some of the dark spots a little bit more efficiently with this technology. So our Core CO2 is a fractionated CO2 device. We use that to treat areas of fine lines and even deep rhytids, which are your deeper wrinkles. We can use it to treat discolorations. It's amazing at treating those really light dark spots that are kind of hard to get sometimes with IPL. It's also great at treating any scars. You know, we've tried to treat those with fractional lasers in the past, but CO2 is the gold standard for scar treatment. The CO2 laser is mainly for your face, okay? It can treat scars on the face, wrinkles, discolorations. However, we do go off the face occasionally for scars and stretch marks. A good treatment candidate is going to be anybody that's looking to get rid of those fine lines, wrinkles, especially here. Like I said, I haven't found a fractional laser in the past that could get rid of those. Also, these lines through here, over here on your cheeks, those are very difficult to get rid of without, even with filler. So those are the primary patients that I'm looking at. My patients that come in, complain of lines here, complain of lines here, and then even some of those deep etched in lines on your forehead that you're not getting completely rid of with Botox. Maximum results are seen with with this device, just like with any other device that is stimulating collagen. You can expect those max results to be approximately 3 weeks after your last treatment. Sometimes it's even about 4 to 6 weeks. Now, this is important. Post-care and downtime. This is not like your normal fractional IPL laser, okay? This is an actual downtime treatment. You will have a downtime of approximately 3 to 4 days. Sometimes it's even a week depending on how deep we have gone. However, that being said, I personally have had it done. My downtime was 3 days, but it's different for everyone depending on which mode I'm using. This laser is I'm able to customize it for all different skin types and concerns. So I may have to go deeper in one area than others. If I'm treating scars, those are deeper. If we're treating around here, that's usually a combination of treatments, which will be more of a downtime. So you leave here with post-care instructions as well as a post-care kit, which should include things like a moisturizer to use afterwards, and some Aquaphor. Aquaphor is very important following this treatment just to keep the area good and moist. That will help you heal the fastest. Results of your core CO2 treatment should last years depending on if you take care of your skin. Again, good skin care, a good diet, and sunscreen are very important, but your skin will always be better for this treatment. You'll have more collagen than you would have had this treatment not been done. Okay, we've got our smoke evacuator going, and then I'm going to do a little test spot and see how it feels for us. Thank you guys so much for attending our Core CO2 event. We hope you enjoyed it and it was very informative for you guys. Now, the winners are going to be notified via phone. You should get a phone call from one of our staff notifying you if you're a winner. You're going to get a text message at the end of this event. Text back yes to book a consultation or an appointment. And lastly, I would love for you guys to stay and chat with us for the next 10-15 minutes, and I can answer all of your questions about the Core CO2. Hi, everyone. All right, great. So it looks like we got a good many people here. So I'm going to start off with the first couple of questions. A couple have already come in. So let's see. Number one, if I want to get this done and filler, what order should I get them done in? So I would usually recommend doing the CO2 first. You got to remember too that, oops, I lost my light, y'all. Hold on. There we go. Usually if the, sometimes you may not even need filler after getting this done. I mean, it does really give great resolution of fine lines and wrinkles. I had some terrible scarring in here, and after one treatment, it's almost resolved. So definitely doing the CO2 first. And then possibly then the filler later. And I usually say, give it a good 4 to 6 weeks between this. Okay, so let's see what else we got. Oh, if you have laser around the lip area, does it cause discoloration long term? So right here is where we have so many, even if you've never smoked, because of the loss of collagen, because of the bone loss that occurs here, we end up, like I always say, that our mouth starts to eat our lips, and it kind of turns in, causes wrinkles here, causes wrinkles here. So I have to go, I usually use a mode called Fusion there. So Fusion is where it combines a medium depth and a deep depth. Okay, so anytime you combine modes like that, the results are going to be great. They're going to be better, but the downtime is a little bit longer, and sometimes your red there a little longer. So, but no, it will not cause any long-term discoloration in that area. So I hope that answered your question. Okay, so I always get this question about the neck. So we have to be super careful on the neck. We can definitely treat the neck. Remember, like our face is super tough. Like we can do a lot to the face and it will not bother it. It will, we can like sandblast the face and it's going to recover because it's used to the elements. It's been exposed all of these years to the elements. So it's tough. The neck, not as much. So we have to go a little milder on the neck. We have to take it a little slower on the neck. We may have to spread those treatments out a little bit more. But still, it's something that can be done. We just have to, again, take our time. And if you're combining face and neck, then we may, say, okay, coming in for the face and the neck this time. We're going to skip the neck the next time. Okay. Let's see, how many treatments are needed? I really always say best results with almost anything is going to be 3 treatments because you're letting collagen build between each treatment, okay? We're going to kind of, again, sandblast the face, and then we're able to get deeper the next time, okay? Okay, so does this work for broken capillaries and redness? Broken capillaries and redness are best treated by IPL, okay? So this is not an IPL device. This is just mainly for people who are suffering from fine line wrinkles and, the dark spots and discoloration. So we do have IPL, of course, but this is definitely not what I would, tell you to go with if that's what you're wanting to treat. Okay, and so we got another question about doing this on the neck. I think we covered that. Okay, so raised hard scars. So the gold standard for scar treatment is always going to be your CO2. We can treat with fractional laser, but we're never going to get as deep as we need to. So it does treat scars better than anything on the market. Now, those raised hard ones, we have to go a little deeper with, and it may take more treatments. Okay, so I hope that answers your question. Neck area. Okay, let's see. Okay, I had a mole removed on my face about 2 months ago. Is there a time limit? I would have to wait to have this treatment done. Okay, so that's another one I always get asked. So it's actually 6 weeks. So 2 months is actually plenty of time for us to go ahead and start treatment to treat that scar. And let's see, no, it's not gonna help with rosacea. The IPL device is the one that I would suggest you go with to treat rosacea, as well as any of the reds. So any of the reds are going to be best treated by our Nautilus system, which is our IPL platform. Okay, so let's see. Okay, cost. So I think that we responded in the text, but I want to, so everyone knows, normal price on this is $1,920. It's on sale right now for $1,365, and that includes all 3 treatments. It also includes your post-care kit, as well as your post-care instructions. Okay, let's see. Melasma. Okay, so our demo patient had melasma. It is almost completely gone. I don't know if you could even tell it anymore. She has had 2 treatments with this, and her melasma was almost, well, I mean, it was pretty much on its way out with the first one. Second one, almost completely gone. Third one, you could barely see it. So we were just kind of trying to hit it. Now, remember, melasma, we don't know how deep it is. You can do like biopsies and things like that to see how deep melasma is, but you know, that's going to cause scarring and stuff. So we generally don't recommend having a biopsy done. But so what we generally do with our melasma patients, the way I'll treat them is one treatment, I'm going to go a deeper mode, like medium mode on my CO2. And then I'll go for the next treatment, I'll go the lighter mode, you know, and then if I'm having better results with one or the other than that very next treatment, I'm going to go with that either light or medium mode again. Let's see. But IPL cannot be done on melasma patients. So always remember that, okay? Let's see. I want to make sure I'm getting all this. Okay, I answered the pricing. Fine lines around the eyes. Oh my gosh, yes. So, it's really going to do great here, great here. I have to, you know, kind of pull outward, you know, to try to get everything that I can without getting in this little orbital rim here. But oh my gosh, you know how we're so crepey under there because our collagen is leaving, and I mean, after we hit age 30, we lose collagen like crazy. So what I'm able to do is, depending on the depth of your skin, I generally always go pretty light here. However, the way that I do it is I'm able to overlap my rings a little bit, and it gives an amazing treatment around the eyes. Okay, let's see. I don't want to miss any of these. I'm trying to make sure. Okay, this is a good one. Okay, it says, I may have missed this during the presentation because I have a house full of wild kids. I feel you. Mine just left. But is it painful? It looks like it might be. I mean, I'm not going to lie. It is, depending on which mode we're using, okay? So fusion is kind of the worst because I told you, like, around here, you know, we're using like that fusion mode that has medium and deep depths, so you feel that a little bit more. So that one's the worst. Actually, the deep depth is the least painful because, you know, we're not bothering any of the skin on top. We're going straight deep, you know, so we don't have as much nerve endings there. And sometimes the light mode under the eyes can be pretty spicy too. So I've had all of those done, you know, and I'm telling you, the fusion's the worst. So right here, we numb you for 30 minutes prior to the procedure. We have a great compounded numbing cream that works excellent. And we also offer you Pronox, which is nitrous oxide, during the procedure as well. So that really helps with the discomfort. And again, it's more like a burning type sensation. And you know, and people have different, like, you know, our model, you couldn't even see her move. Like, she was totally fine. Like, that didn't bother her at all. Me, like, when it was here, that bothered me when I had mine done. But again, nitrous oxide numbing 30 minutes prior to really dramatically helps with pain and discomfort. Can you have this done around the lips if you have had lip blushing? Yes. So of course we're going to stay away from that area because we don't want to damage your blushing, but yes, you can have that done. Absolutely. But you're going to have to wait just a little bit of time, like 6-8 weeks. Spicy. Y'all know my words. So it is spicy. I think I kind of covered that. And again, like it's that heat feeling. Like that's why we say like the oil therapy and the lasers give you that spicy feel, like a hot rubber band. And yes, we know. Okay, I really want to answer this one. What does downtime look like? Peeling redness, what should I expect in the downtime? I really wish I could show you the picture of me because you kind of get the idea. But so the day that you get it done, and you saw on our model, she was red. As the day goes on, you get a little more red, and then your next morning you're red. Okay, so you have to plan for that, right? So if you're getting this done on like a Thursday or Friday, your downtime is going to be those 3 days, and it's mainly redness, swelling too. You'll kind of start to peel on day like 3-4ish, but it's not like peeling off in sheets like a TCA peel or anything like that. It's like just a little bit of mild, just those peeling off that you can just go like that and get it off. And after day 3 or 4, we tell you to go ahead and you can apply some mineral makeup. I did that. I went to a wedding on day, let's say I got it on Wednesday and went to a wedding on Saturday and was able to cover it up with my mineral makeup. And it was fantastic. And no one could really even tell. And then I came home, washed it all off, and that actually took a lot of the peeling that was there off when I washed it, and it was fine. So the big thing about your downtime is going to be, we usually tell you can do vinegar soaks. I was not the best at that, just to be honest, but it does give you a little bit of relief, and it helps prevent any kind of infection. We tell you not to sleep with dogs or cats because those are kind of, everything's open. So you don't want to risk it getting infected or anything, but keeping it covered with like an Aquaphor. And that's kind of the craziest part about it, is because you're super shiny looking. So I did it and I was at work all week and like I was a big grease pit. And, but I mean, it's not a horrible downtime, especially when we're talking about 3 days, and on the 4th day you can put mineral makeup on and you're good to go. Under the eyes, yes, if you did not catch that a minute ago, it is you can use it under the eyes, and it does a phenomenal job. Just because all of that crepiness and whatnot, it's really going to stimulate a ton of collagen to that area. It does great for your crow's feet. Like, I can actually do a deep mode straight into the crow's feet and then follow it with a light mode all the way around the eyes. And again, that deep mode is not bad. So what is Sheena, can you get the if you can hear me, can you get the price for just the one treatment? Because I cannot remember that price right offhand, and we've got a question with that. We do generally recommend the 3 treatments. Honestly, you do get an excellent result with one, but for complete resolution of your like if we're treating a fine line or wrinkle, or we're treating melasma, or we're treating a few dark spots, then it's going to take probably 3 treatments to get them gone. Okay. Stretch marks, yes, stretch marks, it works excellent for. Stretch marks are considered scars, so we can definitely treat those stretch marks with our core CO2. Will it reduce the size of pores? Yes. Oh my gosh, it does so good with that. Like, I had a patient in the other day, and she came back and she's like, one of the biggest things that she could see the difference was the change in the size of pores. Especially, you know, right here on the nose. Like we don't have a lot of fill in there, you know, and then and that's pretty deep skin, so I can use the deep mode, go in, zap all those pores away, and you're able to tell that after the very first treatment. Okay, do you have pictures of the healing process each day? We can get those to you for sure. When I was doing it, I may have missed one day, but still I've got the following days, so we can send that over to you. Or I can just post that maybe in the next day or so on social media. Will it help with my ugly eye bags and dark circles? And so it definitely will help with the eye bags. You know, dark circles, I mean, I wouldn't say that it's going to do phenomenal with that, except for the fact that it's going to stimulate more collagen. So if it's real thin, it may reduce the darkness aspect of those. Can you do your chest? So again, we're really careful moving off of the face. Stretch marks, you know, not a big deal. Scars on the body, not a big deal. We can treat those with deep mode, and it really does a good job. We just have to be super careful with these thinner areas here and here. So again, we might have to go a little bit lighter, and then put your, you know, each treatment a little further out than we normally would. We normally do these treatments about 4 to 6 weeks apart, and we may say like 6 to 8 weeks, just depending on the healing process. We watch you really closely because we want to make sure that you're healing properly. Let's see. I will do one of these for the IPL. We just got another new device. We've always had an IPL device, but we just got another IPL device. We upgraded, and so we will definitely do one for those. Oh, so how long is the sale? I really have to decide. But since y'all are asking me, I'm gonna pin it down. Let's do about we'll do about 2 weeks, okay? Under eye bags, yes, definitely. I think I said that a little bit earlier. It's going to help with those under eye bags. Melasma and sun damage, is there a difference? And is IPL better than you know, for the sun damage? Okay, so let's talk about that. It depends on if it's isolated sun damage. So remember, the sun causes our fine lines and wrinkles. The sun causes the discolorations as well. We call it photoaging. So if you have just isolated dark spots, then probably the IPL is going to be the best. If you have, like a lot of us do from years of tanning beds and whatnot, if you have fine lines and wrinkles and dark spots, I'm going to tell you, you might as well just do the CO2, because I can go in there and I can say, oh, here's a line. I'm going to treat the line with this setting. Oh, here's a dark spot. I'm going to treat the dark spot with this setting. So I'm able to like change my settings depending on what I'm treating on the face. I love it because that is my favorite thing to do. If people have multiple problems on their skin, I can use multiple different modalities to treat those specific problems. So we'll always talk about it when you come in. I'll be like, you know, what is your major issue? And what is bothering you? And then I'm going to also look at your skin and be like, well, she needs a little bit of a medium mode here or a deep mode here. Puffiness and dark circles. I think I got that one. How long does a treatment take to complete? I know we kind of spliced on the video, but usually you're going to come in for 30 minutes prior to your actual treatment time to numb. Okay, to a numb for those 30 minutes. If you're getting the Pronox, which is the nitrous oxide, the laughing gas, we'll get you all set up for that, and we'll let you go ahead and do a little bit of those puffs prior to. And then, I mean, honestly, just depending on, on my specific patient that I'm working with, but really only like 20, 30 minutes max. It's usually about 20 minutes, 25. And then following the treatment, we're going to get you cooled down with a cold roller. Okay. So cooling down with a cold roller, and then we go ahead and cover you with Aquaphor before you leave out. Okay, what's the big difference between this and the old therapy I had done? So both are going to stimulate a lot of collagen, okay? Both are going to tighten. Now, old therapy actually tightens and lifts. It's the gold standard. It goes deeper than any other device on the market to actually tighten and lift an area. So if we're talking about here that you're needing tightening and lifting, and even like, up through here, oil therapy is probably going to be one of the, your better bet, especially, in this area. Okay. The CO2, on the other hand, we're able to target those superficial things that we can't get with oil therapy. So again, your dark spots, and then any fine lines or wrinkles or texture irregularities, such as pore sizes and things of that nature. Is it stinky like lip fillers? It's completely different feeling. And y'all know I like the word spicy, but it is. It's just that spicy, hot feeling. And so we cool you down immediately afterwards. I'm pretty darn quick, depending on if I'm doing it or Emily's doing it. We both move pretty fast. So, whereas lip fillers, I'm sticking your lips for 20, 30 minutes. With this, we're moving, and I think as long as you keep moving, that's where it's helpful. Can you treat only one area of the face, or is it all or nothing type deal? So we have not sold it to people for just an area of the treatment, unless we're just doing a scar. And I will, and the reason is because when I tell you, like, this thing resurfaces the skin, it resurfaces the skin. So if we're just treating like an area here, you're gonna be like, oh my god, that looks so good, and then the round's not so much. So it's just a really nice overall treatment. I've talked to a lot of my patients about this area. And if they do have isolated, like the lip lines here, and we got nothing anywhere else, then, if you want to, we can definitely just do the lip lines. My fear though is that you're going to love it and you're like, oh, I gotta have the rest done, but we could definitely talk about pricing for just the lip lines, because I know so many of my ladies are like, I don't want filler, there in my lips or whatnot. I just want the lip lines treated. And in the past, I couldn't get them treated with fractional laser. Again, just was given suboptimal results. And then you can't fill those with fillers. It just doesn't do a good job, each little line. And so we would always just kind of like try to stimulate the lip back and pull it up out of the mouth, which does a good job, but still you're not gonna have complete resolution of those lines. So for those ladies, we could definitely talk about maybe just treating there. How long does the pain last? Okay, so that's a good one. So the pain is going to be, you're gonna be really hot, like really hot afterwards. And that's why we cool you down. You saw our little model. She had that cold roller, and that cools you down really quick. Okay. So once we put that Aquaphor on, it gets a little hot again. But again, you can immediately go home and put like some ice packs on if you need to, or bring an ice pack with you. And that'll definitely help. But really, it's no like pain afterwards. It's just that heat feeling that we try our best to to help you out with while you're there. Can you get Dysport and this procedure at the same time? So I generally recommend not doing that, just because, oh, there went my light again. Hold on. Okay. So I generally recommend not doing that because everything is kind of open and swollen. So, you know, I can't really see the lines that well and whatnot. So I would recommend spacing that about really just 2 weeks apart. Let's see. No cleaning the face while the skin is red, just Aquaphor. No cleaning the face while the skin is red, just Aquaphor. So for those first couple of days, like your best bet is going to be like a mixture of water and a little bit of water and vinegar. Water and vinegar is really good. And then you just wipe that Aquaphor off because you don't want to just keep piling it on and piling it on and piling it on. But Aquaphor will be your best friend. Like the more moist you keep your skin during this process, the better, and the quicker the healing times. Does it do a better job at reducing pores compared to IPL? Oh my gosh, yeah. Like IPL isn't really going to touch your pores that much, but CO2, again, with that first treatment, I'm able to go pretty deep, especially here, and knock those pores out. I love it for pores. Okay. Let's see. I'm gonna let Sheena respond to that. Okay. After the initial 3 treatments, how often should I get this done? I mean, if you really take good care of your skin, you may not really need this done again for a very, very long time. But I mean, you could definitely come in for a little touch up. You probably wouldn't need the full 3 treatments. Like if you're like, oh, I'm seeing a couple of lines come back or darks come back, then come on back in and we can do like a one treatment regimen for you. Well, how long does a treatment usually take? I answered that a little bit earlier, but let me just cover it again. So about 30 minutes numbing. You know, it takes me about 20 minutes, me or Emily, to complete the procedure, and then cooling, and then Aquaphor. So your total time in the office is about an hour, but the treatment time is only about 20 minutes. Okay, so yes, swelling. So a lot of people swell during this procedure. I swelled. And again, I'm going to post those pictures. I need to do that. Because like that night I was pretty swollen, and the next day when I woke up I was pretty swollen. But other than that, like, I mean, not terrible. You know, the swelling. Oh, and as far as like you can always use like the ice packs, and then as well as arnica. Arnica will definitely help with the swelling. Okay, so let me just make sure I don't want to miss anything. And don't forget, you guys will be getting a text at the end of the Q&As, and just reply yes if you want to be contacted for a consultation. Did I get everything? I don't want to forget anybody. There's a couple that I'm just going to let Sheena respond to. As far as like pricing and IPL and all that kind of stuff. So okay, we'll double check. Okay, so I'm getting a couple of duplicate questions, but I'm going to go ahead and answer this because I do get this all the time. The neck or chest again. So we can do it on the neck. We have to be super careful. It may take a little longer of a treatment regimen because the neck and chest are a little bit slower to heal. They're thinner skin. We have to be super duper careful. And so instead of it being every 4 to 6 weeks, it may need to be every 6 to 8 weeks. Okay. I think that's it, guys. So if okay, wait. Okay, one more. So do you get redness and peeling for all 3 treatments? I mean, you do, yeah. Mhm. It's gonna be for all of them. If I'm not having to go as deep on the other ones, I mean, you may not have as much. So again, this is the worst when I have to use the fusion mode around there to get those deep, little lines around the mouth. So that fusion mode, combines the 2 modes together, and that's the one that is the slowest. But we got masks right now. If anybody, if you're like, oh, I'm going out in public and I don't want anybody to see it, this is going to be the longest area to heal. Okay, all of this will be completely back to normal, and you still may have a little bit of redness around here, and that is just because of those 2. That combined treatment mode. But we have masks, and so if you're like, really concerned about it, just wear a mask out and about. That's what I've been doing recently when I get stuff done. Okay, so if I want to focus on skin resurfacing but have the broken capillaries, will I have to do a CO2 and IPL? Is it better to discuss options in a consultation? We can definitely talk about that. And you may just want me to look at your skin and then after I look at your skin, make recommendations, because sometimes the IPL needs to be, it just depends on how bad the broken capillaries are. Sometimes the IPL needs to be 3 treatments as well. So we can definitely talk about that for sure. But just book your consultation, reply yes, and I'll get you in there and double check your skin so I can tell you the best thing for you. And no bruising with this. That's the last question I've got up there. No bruising, just the redness and a little swelling and a little bit of peeling. Okay. So I think that's it, guys. Yay! It was so great seeing all you guys, and thanks for the great questions. Again, you're gonna get that text at the end, so reply yes if you'd like a consultation. See you guys.